This video series is funded by Jewish Hospital Foundation, Norton Healthcare, and the United States Surgical Corporation. This tape shows the internal organs of the thorax and of the abdomen, and the male and female reproductive organs. In this first section, we'll look at the organs of the thorax. First the heart, then the lungs. We'll also look briefly at the esophagus. The thorax itself, the upper part of the trunk which contains the heart and lungs, is shown in tape 3 of this atlas. Here we're looking at the contents. To understand the heart, we'll begin by seeing where it is. We tend to put the heart here in our imagination, but in reality, it's much closer to the midline. Seen from in front, the heart is here. It lies behind the sternum and directly above the diaphragm. Seen from the side, the heart is here, occupying almost all the space between the vertebral bodies behind and the sternum in front. When the diaphragm moves, the heart moves with it. To get our first look at the heart, we'll start by removing the upper extremities and all the shoulder muscles that surround the upper thorax, so as to leave just the thorax itself, enclosed by the ribs and intercostal muscles. Then we'll remove this part of the rib cage on each side, revealing the lungs, which are fully inflated here. When we let the lungs deflate, we can see the heart behind the sternum, contained within its protective jacket of pericardium. To see it better, we'll take the lungs, the sternum, and the pericardium out of the picture. This is the heart. This is the diaphragm. The major blood vessels that lead into and out of the heart take up almost as much space as the heart itself. Now that we've seen where the heart is, we'll take a detailed look at it. We'll look at its 4 chambers and its 4 valves. Then we'll look at the great vessels that enter and leave the heart, and lastly, we'll look at the coronary arteries. Because we so often see simplified diagrams of the heart like this, we tend to think the atria, the inlet chambers, are above, and the ventricles, the pumping chambers, are below. It's perhaps surprising to see that in reality, the atria aren't above the ventricles, they're behind them. Here's the heart in isolation. Here are the ventricles in front. Here are the atria behind. This generous coating of epicardial fat makes it hard to see the 4 chambers distinctly. To see them more clearly, we'll go to a heart in which almost all the fat has been removed. In this specimen, all 4 chambers have been distended with equal pressure, making the atria somewhat larger than normal. This is a directly posterior view of the heart. This is a directly anterior view. The massive thick-walled left ventricle projects forward and to the left. The thinner-walled right ventricle is partially wrapped around the left one. We'll see the ventricles by themselves in a minute. For now, let's go round to the back and look at the 2 atria. This is the left atrium. This is the right atrium. Blood coming from the upper part of the body enters the right atrium by way of the superior vena cava. Blood coming from the lower part of the body enters it by way of the much larger inferior vena cava. In a more intact dissection, here's the inferior vena cava coming up through the diaphragm and almost immediately entering the right atrium. In addition to the two venae cavae, blood from the heart itself enters the right atrium under here by way of the coronary sinus, which we'll see later. From the upper part of the right atrium, this blind pouch, the right auricle or atrial appendage, projects forwards. The thin wall of the right atrium is formed largely of muscle. When the atrium contracts in diastole, the blood in it passes forwards into the right ventricle through the right atrioventricular valve or tricuspid valve, which is here. The left atrium and the right atrium are in contact here, where they share a common wall, the interatrial septum, which lies quite obliquely. To look at the inside of the right atrium, we'll remove this part of its wall. Here's the opening of the superior vena cava above and of the inferior vena cava below. Here's the opening of the coronary sinus. This is the part of the atrial wall that's shared with the left atrium, the interatrial septum. This thin oval patch in the septum is the fossa ovale, the remnant of the foramen ovale that connected the two atria in intrauterine life. Here we're looking forwards into the tricuspid valve. We'll see more of it when we look at the right ventricle. Now we'll move on to look at the left atrium. Blood coming from the lungs enters the left atrium by way of the four pulmonary veins, two from the right lung, two from the left. The left atrium, like the right one, has a blind pouch, the left auricle or atrial appendage, which projects upwards and forwards. In diastole, the blood that's in the left atrium passes forwards into the left ventricle through the left atrioventricular valve or mitral valve, which is here. To see inside the left atrium, we'll remove this part of its wall. With the four pulmonary veins removed, the inside of the left atrium is relatively featureless. Here's the interatrial septum again, and here's the remnant of the foramen ovale seen from the left side. Here we're looking forwards into the mitral valve. Now we'll move on to look at the two ventricles and their inlet valves. To see them clearly, we'll look at a heart in which the right and left atrium have been removed, leaving just the two ventricles. Here's the right ventricle seen from the right side. Here's the left ventricle seen from the front. Going round to the back, this is the right ventricle. This is the left one. They're separated by the interventricular septum, which is here. We're looking forwards into the wide-open atrioventricular valves, the tricuspid on the right, the mitral on the left. On the right side, blood passes downwards and forwards to fill the right ventricle in diastole. Then, in systole, it passes upwards and to the left into the pulmonary trunk, passing through the pulmonary valve, which is here. On the left, blood also passes downwards and forwards to fill the ventricle, then gets turned completely around in systole, passing upwards and backwards into the aorta. It passes through the aortic valve, which is out of sight, here. To see inside the right ventricle, we'll remove this part of its wall. The tricuspid valve is here. We'll look at it in a minute. The pulmonary valve is up here. The anterior part of the right ventricle, the apex, extends out of sight down here among these intersecting bands of muscle called trabeculae. This is part of the interventricular septum. The left ventricle is on the other side of it. Now let's take a look at the tricuspid valve and its appendages. The tricuspid valve is also called the right atrioventricular valve. It usually has 3 cusps, sometimes only 2. Here there are 3. They're known as the septal, anterior, and posterior cusps. The posterior cusp is partly out of sight. These strands of tendon-like material attached near the edges of the valve cusps are the chordae tendinei. They arise from papillary muscles, which project from the wall of the ventricle. The papillary muscles and chordae tendinei prevent the cusps of the valve from prolapsing back into the atrium during systole. Here's the tricuspid valve set in motion passively by an intermittent current of water. When pressure in the ventricle rises, the cusps of the valve close together along quite an irregular line. The inside of the right ventricle is made irregular not only by the tricuspid valve and its appendages, but also by these numerous bands of muscle, the trabeculae coni. The trabeculae form a dense crisscross pattern over much of the ventricular wall, especially here toward the apex. To see the outflow pathway of the right ventricle, we'll go to a different specimen. The tapering part of the right ventricle that leads up to the pulmonary valve is known as the infundibulum and also as the conus. Unlike the rest of the right ventricle, its lining is smooth. We'll look at the pulmonary valve in a minute. Now we'll move on to take a look inside the left ventricle. We'll remove this part of its wall. The mitral valve is here. The aortic valve is out of sight up here. This is the apex of the ventricle. This part of the ventricular wall forms the interventricular septum. Here's the left ventricle in cross-section. Here's the right ventricle. The interventricular septum is curved. The left ventricle has a much thicker wall than the right, and it's circular in cross-section, while the right ventricle is C-shaped. Here, we're looking backward into the mitral valve. To see it better, we'll return to the previous dissection and go round to a view from behind. The mitral valve, also called the left atrioventricular valve, has 2 cusps. They're called the anterior cusp and the posterior cusp, though in reality they're more upper and lower. Chordae tendinei from both cusps converge on 2 sets of papillary muscles. These on the posterolateral wall of the ventricle, and these on the anteromedial wall. Here are the same papillary muscles seen from the apex of the ventricle. Each group of papillary muscles sends chordae tendinei to each of the cusps of the mitral valve. Here's the mitral valve in motion, seen from the apex of the left ventricle. Here are the papillary muscles, seen very close. Above the mitral valve, we're looking upward and backward along the outflow tract of the left ventricle toward the aortic valve. In this cutaway dissection, we can see the outflow tract of the left ventricle from the side. Here's the aortic valve. We've left intact part of the anterior cusp of the mitral valve, along with the chordae tendinei and papillary muscles. The anterior cusp of the mitral valve forms part of the wall of the outflow tract, so blood flows past it this way in diastole and this way in systole. Here's the anterior cusp of the mitral valve in motion, with the mitral valve opening below it and the outflow tract above it. Now that we've seen both ventricles, we'll move on to look at the two outflow valves, the pulmonary valve and the aortic valve, and also at the pulmonary trunk and the first part of the aorta. Here are the two ventricles, dissected so that we can see the outflow valves. Here's the aortic valve. Here's the pulmonary valve. Each has 3 cusps. The pulmonary trunk and the aorta are markedly dilated at their origins. On each vessel, the dilatation consists of 3 bulges, or sinuses, whose position matches the position of the valve cusps. To get a better look at the cusps of the outflow valves, we'll remove these parts of the vessel walls. Each cusp of an outflow valve is shaped like 1/3 of a parachute. Here the cusps are hanging loose. Each cusp has a delicate free border which closes against those of its neighbors. Here's the pulmonary valve in motion. In diastole, back pressure closes the valve abruptly, the 3 cusps pressing against each other to meet exactly at a point. Here's the aortic valve. It works in just the same way. Here's the opening of the right coronary artery, which we'll see in a minute. The left one is out of sight, down here. Now that we've seen the outflow valves, we'll move on to look at the 2 major outflow vessels, the aorta and the pulmonary trunk. To see them, we'll go to a more intact dissection. The pulmonary trunk passes backwards to the left of the aorta, then divides into the left pulmonary artery and the right pulmonary artery. The right pulmonary artery curves around above the left atrium, passing behind the root of the aorta and behind the superior vena cava. This early branch supplies the superior lobe of the right lung. This cord is the divided ligamentum arteriosum, the remnant of the ductus arteriosus, which connects the pulmonary trunk and the aorta in intrauterine life. Here's the aorta. It starts to the right of the pulmonary trunk. Its beginning is well hidden in the epicardial fat. In front of it is the right atrial appendage. To its right is the superior vena cava, and behind it is the right pulmonary artery. Next, we'll take a look at the coronary arteries, which provide the vitally important blood supply to the heart itself. The detailed branching pattern of these vessels is highly variable. What we'll see here is just one example. To see the coronary arteries, we'll look from above at a heart from which most of the epicardial fat has been removed. Here's the pulmonary trunk. Here's the aorta. To see where the coronary arteries arise, we've removed both atrial appendages. The left atrial appendage was here. The right atrial appendage was here. Here's the right coronary artery. It arises from the right aortic sinus, which is here. The right coronary artery gives off this branch to the upper part of the right atrium, then runs downwards in the right atrioventricular groove, giving off branches to the right ventricle. The right coronary artery passes round to the underside of the heart. Here it is again. Its terminal branch is the right interventricular artery. Now, we'll look at the left coronary artery. Here it is. It arises behind the pulmonary trunk from the left aortic sinus. The left coronary artery soon divides, giving off this circumflex branch and several branches to the left ventricle, the longest of which is the left interventricular artery, also called the left anterior descending artery. The circumflex branch of the left coronary artery runs around to the underside of the heart in the left atrioventricular groove, sending further branches to the left ventricle. The blood that goes out by way of the coronary arteries returns mainly by way of a system of coronary veins, which join to form a large venous channel, the coronary sinus. As we saw earlier, the coronary sinus ends by entering the underside of the right atrium here. Here's the coronary sinus in an intact heart. The coronary sinus passes around the left intraventricular groove to the underside of the heart. Its opening into the right atrium is just below and in front of the inferior vena cava. Coronary veins from the right side of the heart also empty into the coronary sinus. Now that we've seen some dissected specimens, let's take a further all-around look at an intact heart with all the epicardial fat intact. We'll take a second look at all four chambers in the order in which blood passes through them. Here's the right atrium with the superior vena cava entering above and the inferior vena cava below. Here's the right atrial appendage. Here's the location of the tricuspid valve. Here's the right ventricle. It's almost obscured by fat. Here's the infundibulum. The pulmonary valve is here. Here's the pulmonary trunk passing to the left of the aorta and dividing into the left pulmonary artery and the right pulmonary artery. Here's the left atrium with two pulmonary veins entering on the right and two on the left. Here's the left atrial appendage. The mitral valve is here. Here's the left ventricle. Its outflow pathway is here, leading to the aorta. Here's the aorta, and the aortic valve is here. So far, we've been looking at the heart by itself, with the major vessels that leave and enter it divided. To see where those vessels go, and also to see the pericardial sac around the heart, we'll look at a dissection in which the anterior chest wall has been removed, from the first rib to the eighth rib. The diaphragm is here. On each side, the lungs are quite collapsed. If they were fully expanded, they'd be out to here. Here's the heart, hidden within its protective sac of pericardium. In the intact body, the front of the pericardial sac is attached to the back of the sternum by this strip of mediastinal fat, all of which we'll remove. All this is the pericardial sac. The only major vessels we can see at this point are the aorta, emerging from the pericardial sac here, and the superior vena cava, entering it here. To see more, we'll remove this much of the pericardium. Here's the heart, well covered with epicardial fat. The ventricles are freely mobile within the pericardial sac. Below, the pericardium is reflected onto the upper surface of the diaphragm, to which it's densely adherent. To right and left, the pericardium lies back to back with the parietal pleura. Here's the root of the aorta and of the pulmonary trunk. Here's the superior vena cava, entering the right atrium from above. Each of the great vessels passes through an adherent cuff of pericardium as it enters or leaves the pericardial sac. Here's the inferior vena cava, coming up through the diaphragm. Here are the left pulmonary veins and the left pulmonary artery, passing through the pericardium separately. On the right, the pulmonary vessels are harder to see because they leave through a continuous cuff of pericardium that they share with the inferior vena cava. Here are the pulmonary veins. The artery is out of sight, up here. Once we've understood the heart in 3 dimensions, understanding the great vessels that enter and leave it becomes straightforward. The superior and inferior vena cava and the aorta are shown in tape 3 of this atlas. and we'll see more of the pulmonary artery and veins later in this section. Now let's review what we've seen of the heart. Here's the right atrium, the atrial appendage, the superior vena cava, and the inferior vena cava. Here's the interatrial septum, the fossa ovale, the opening for the coronary sinus, and the tricuspid valve. Here's the right ventricle. Here are the papillary muscles, and the chordae tendineae, and the infundibulum. Here's the pulmonary valve, and the pulmonary trunk, branching into the left pulmonary artery and the right pulmonary artery. Here's the left atrium. Here are the pulmonary veins, right and left. Here's the interatrial septum again, and the mitral valve. Here's the left ventricle, the interventricular septum, the left ventricular outflow pathway, the aortic valve, and the aorta. Here's the left coronary artery. Here's the right one. Here's the coronary sinus. Here are the pericardium and pericardial sac. Now, we'll move on to look at the lungs. Before looking at the lungs, it's important to understand the structures that contain them: the thorax, the two pleural cavities that lie within it, and the structures that produce respiratory movement are shown in Tape 3 of this atlas. Seen from in front, the lungs are here. Seen from behind, they're here. Seen from either side, the lung is here. A large part of each lung lies behind the heart. The lung extends from the ribs in front to the ribs behind, and from the dome of the pleural cavity down to the diaphragm. With each breath in and each breath out, there's an increase and a decrease in the volume of the lungs. Here are the lungs by themselves, seen from in front. They're being inflated with air so as to maintain their shape. Here's the trachea. Here are the two principal bronchi. This is the apex of each lung. This is the base. The space between the two lungs is occupied by the heart and great blood vessels. Each lung has three surfaces. The medial or mediastinal surface is marked by the hilum, where the bronchi and blood vessels enter. The concave inferior surface rests on the diaphragm, and the large convex costal surface faces the rib cage. Each lung is divided by deep fissures into lobes. The right lung has a superior lobe, a middle lobe, and an inferior lobe. The left lung has only a superior and an inferior lobe. Here are the lungs seen from behind. The fissures that separate the lobes extend all the way round onto the mediastinal surfaces. The space between the posterior parts of the lungs is occupied by the vertebral bodies. To see the lungs in a more intact setting, we'll look at a dissection in which the anterior chest wall has been removed. Again, the lungs are being inflated with air to keep them expanded. The surface of these lungs is discolored by trapped carbon particles that come from a lifetime's exposure to smoke. The two lungs are separated by the mediastinum, the midline partition that's occupied largely by the heart and great vessels, and also by fat and lymph nodes, and in childhood by the thymus gland. The surface of the lung is formed by the visceral pleura. The visceral pleura covers the lung completely, except here at the hilum, where it becomes continuous with the parietal pleura. Taking a close look at the edge of the lung, we can see the alveoli, the tiny air spaces where gas exchange occurs. They are opening progressively as we slowly inflate the lung. Here, we're letting the lung collapse. so that we can see the two separate pleural surfaces, parietal and visceral. The two surfaces are normally in close sliding contact with nothing between them except a film of serous fluid. When we have the thorax laid wide open like this, it's hard to appreciate the seal that normally exists between the two pleural surfaces. To see that, we'll go to a more intact dissection. To expose the parietal pleura, we'll remove the intercostal muscles from these intercostal spaces. The parietal pleura that lines the chest wall is attached to the inner aspect of the ribs. The visceral pleura, covering the lung, slides just beneath it. When we puncture the parietal pleura, we break the seal between it and the underlying lung. The lung, no longer pulled outward, slowly collapses as air enters the pleural cavity. Here in an open dissection, we're producing the same event, collapse of the lungs, by ceasing to inflate them. The function of the lungs as organs of gas exchange depends on our ability to breathe in and out. In this, the lungs themselves are passive. Their shape and volume conform from moment to moment to the shape and volume of the cavity they're in. When the diaphragm contracts and moves down, and when the intercostal muscles move the front of the rib cage upward and forward, then the volume of the thorax increases, the lungs expand, and air is drawn into the lungs. When these movements are reversed, the lungs are squeezed into a smaller space, and air is blown out. Now we'll look at the pulmonary vessels and the trachea. To do that, we'll take the heart out of the picture and draw the lungs out to the side. This gives us a view of the medial surfaces of the lungs. There's a lot to see here. We'll look at blood vessels first. This is the aorta, heavily calcified in this specimen. It's been divided just at the beginning of its arch. Here's the divided right pulmonary artery entering the hilum of the right lung. Here's the left pulmonary artery. A little below the pulmonary arteries on each side are the pulmonary veins. Here on the right, here on the left. Above and behind all the great vessels is the lower end of the trachea, or windpipe. It passes downward into the thorax, just to the right of the aortic arch. Here are the same structures in a different specimen. Here, we've left the lower part of the pericardial sac intact. Here are the divided ends of the pulmonary arteries and pulmonary veins. Remembering what we've seen of the heart, it's not hard to envision the pulmonary trunk and its bifurcation here, and the left atrium, if we were to stretch it out, here. If we take the aortic arch out of the picture, we can see the trachea coming down through the superior thoracic aperture, behind the upper part of the sternum. Here's the trachea by itself. Its upper end is continuous with the cricoid cartilage. It ends here, where it divides into the two main or principal bronchi. The principal bronchi begin to branch as they enter the lung, first into lobar, then segmental branches. The corrugated appearance of the trachea comes from the series of C-shaped cartilages that strengthen its wall and keep it open. In between them, the tracheal wall is soft, so that the trachea is highly flexible. Here, we've divided the trachea close to its bifurcation. The cartilages end here, making the trachea somewhat D-shaped in cross-section, with a posterior wall that's quite soft. Before ending this section, we'll briefly look at the esophagus. Here, in a dissection where we've removed all the pericardial sac, we can see the lower end of the esophagus. The esophagus passes behind everything else in the mediastinum, to reach the esophageal hiatus in the diaphragm, through which it passes to enter the stomach. Now, let's review what we've seen of the lungs. Here are the lungs. On the right side, here's the superior lobe, the middle lobe, and the inferior lobe. And on the left, the superior lobe and inferior lobe. Here's the parietal pleura and the visceral pleura. Here's the hilum of the lung, with the trachea, the principal bronchi, the pulmonary arteries, and the pulmonary veins. Lastly, here's the esophagus. That brings us to the end of this section on the thoracic organs. In the next section, we'll look at the abdominal organs.